We're going to begin by learning a little bit, and it is fairly disturbing news about what's been going on in the healthcare system. And if many of you, like me, are in private practice by yourself or in a small group, we have times of the year that we know we're going to be busy. We have sometimes, January, February, for example, where we expect a little bit to be uh, slower. But sometimes we get slow and we don't know why. We're like blind mice. We don't know what's going on around us because we're just in our own small little worlds. And for the most part, we don't have access to a lot of up to the minute, essentially, information like we're being provided here tonight. So this is very fascinating. These guys at Aerolays are very dialed into this whole situation that is evolving even as we speak. We have added slides to this slide deck within the last week. So this is absolutely up to the date, up to the minute knowledge about what's going on. And things are changing rapidly, and they are changing in a very profound way that can really affect us all. So, what's going on? We're seeing that no one's staying in their own little lane. Insurers are becoming providers. United Healthcare is not only an insurance company, they have their own providers. Humana, same thing. Providers also are becoming insurers, such as we've seen in Kaiser, Sanford Health. And the new thing is that big retail brands are starting to merge into these arenas. Mainly, we're going to focus today on what we're seeing with CVS Health and their Minute Clinics. Okay, so all the entities are trying to go after patients directly and to treat them. So they're going after insured patients or even self-pay patients, and everybody's trying to take a little piece of the pie. Everybody's, essentially nipping at our heels, as it were. The goal is to cut independent physicians out of the equation unless their demands are adhered to. And we'll see this in a couple of slides coming up. So CVS, for example, and Walgreens, this is where things are changing rapidly. And you can see some of the quotes here. We're really much more than a pharmacy. We're on the front door to a path to better health. Why not use these locations as a strategy for healthcare? We have the space and we should use it. And the Minute Clinic is really the focus of a lot of the changes and becoming the partner of choice for all payers. This is all from from CVS. CVS is targeting the most populous and the wealthiest areas. And we're going to take a look in a minute. They do have a balance of payers. They have patients coming that are insured, self-pay, and from government assistance. And here's the maps showing where the concentration of the Minute clinics are. And as you can see, they are in the wealthier parts. They are in the most populated parts of the country. So areas that are big cities, they're not going after, they're not trying to do good work and going into the poor sections or the sparsely cared for areas. They're going directly where the money is, where the people are. And as of 2018, they have over 1,100 Minute clinics. And so, at first this appears to be, something that we've seen already, these sort of urgent care situations. But if you think about it, this is a partnership between CVS and Aetna. Okay, so they've merged. So now we have an insurance company, and we have pharmacy partnering together. And they're opening Minute clinics. So what are they doing here? They're getting providers, generally in the form of nurse practitioners and physician assistants. They're actually looking specifically to go for dermatology patients, for dermatologic conditions as something that they feel they can see right there in their Minute clinics or on video conferencing, $59 video conference. And here's a partial list of dermatology conditions that they are actively seeking: acne, rosacea, psoriasis, hair loss, all of the kind of bread and butter stuff for us in dermatology. And patients are using this service more and more because a lot of us dermatologists have waits. They don't want to wait. They want to get right in. They go to the Minute Clinic. But how are they being treated there? Essentially not well, as we're going to see. But this is a slide that we just inserted within the last week. This is an actual screenshot of Dr. Kindred's phone, what she had to send out to her patients. I believe she's in the DC area. She had been with Aetna, and Aetna turned her down for reapplication, saying that we are not accepting new providers in your field of practice at this time. And she was also told that they had an adequate number of dermatologists. Now, in fact, there is a shortage of dermatologists in that area, but what they have is many Minute clinics. So any of us could at any time be told, you know what, we don't need you anymore. We have enough dermatologists. So she was forced to send this letter out to her patients saying, sorry, you can come and see me and pay cash, and she hopes to get back on it. And Aetna's actions are part of a bigger trend. Companies, large corporations, in their efforts to continue to provide healthcare insurance for their employees, are finding it, of course, more and more and more expensive. And so they are banding together to create a health transformation alliance. And they are building out a preferred provider network, and they are in charge therefore, of directing the dollars as they see fit. When they are able to leverage their size and their ability to negotiate as a group, they are absolutely changing how healthcare is delivered. And here's a quote: "Our healthcare system is broken. Others have tried to fix it, but the approaches have been the same, and so has the result. They aim to modify and improve the current provider delivery system, among other goals." Walmart, GE, Boeing, and Lowe's have already begun to bundle their healthcare services for employees directly and establish these centers of excellence. So they're negotiating with specific providers who will accept lower payment than what would be a traditionally fee-for-service payment. And then they're grouping them in centers of excellence, and you are directed, if you're an employee, this is where you then must go for your health care. And if you don't, as a provider, if you don't join their centers of excellence and accept their terms, if you even wait a little bit, that can mean exclusion from the network. And interestingly, that they're making their employees go to these centers of excellence, and they will even cover travel costs for their staff. It is more advantageous financially to cover some travel costs associated and still keep their patients within a small group rather than have them utilize their own physicians. It's not limited to national companies. GM is doing this. They use a single hospital system, Ford Health System, for all of its salaried employees in the Detroit area. And they cover everything from doctor's visits to surgical procedures. And 11% of employers say they plan to do such broad deals with healthcare providers next year. So they're going to increase this significantly. This is a new trend. It's going forward, and nobody's stopping it at the moment. No one is safe. This came up within the last 2 days. We put this slide in. So there is a physician specialty pharmacy, one of the specialty pharmacies that we frequently use in dermatology, that help doctors get branded medication. CVS and Aetna saw that too many patients were being filled branded prescriptions, did not like the cost that the pharmacy was accruing, and said this letter, which is hard to read, but essentially says, "You cost too much, you owe us money, and as a result, we are not paying you." They withheld revenue from, I believe, October 1st on, all of a sudden from Epic, the pharmacy benefits managers are doing that. And interestingly, in our local newspaper, I'm in the Philadelphia area, so the main newspaper, the Philadelphia Inquirer, has been having stories last 2 days about pharmacy benefits managers and how they're not able to be, they're not direct employees of the government, they're not direct employees of the pharmacies, they're kind of their own little world, and they're able to do whatever they want. It's unbelievable. The government also is trying to push a major change. As this quote says, this is one of our prime goals at CMS, to get rid of fee for service. So we are really on the precipice of a major, major change in the way healthcare is delivered and paid for. And in our own little practices, it's very, very, I mean, even the big people are having a difficult time figuring out what to do with this, much less someone such as myself who's, my own practice. It's a very daunting situation. All the large players are circling around us in our practice. It's the perfect storm for independent physicians. So our medical dermatology revenues are at risk. But what can we do? So here's a slide that first gives us some thoughts about how we can possibly fight back. So with CVS and Aetna, the Minute Clinics expanding into prescribing treatments, they're going to have all the same generic-based cookie cutter, same treatment regimen for every patient. We can fight back by offering new treatments that show results faster and more modern than what the nurse practitioners at the Minute Clinic can do. As far as insurance and corporations trying to build a stronger relationship, we combat this by offering personalized, differentiated, modern treatment experience that leverage technology and stands out from the cookie cutter corporate medicine that these areas are certainly going to be. And having the employers move together to remove their staff from commercial insurance, we offer differentiated modern treatments that keep patients coming in even in the face of their employer-sponsored providers. Again, a summary. We all know we need to make more money to keep up with declining reimbursement. We also need to stay ahead of the treatment curve with advanced care by adding services that provide significant results. We have to look at how we are currently treating diseases. Are there better ways that we can address them clinically while driving profitability? And it really is not enough just to extend into services like aesthetics, anti-aging, or something else. We have to be advanced in our core medical treatment offerings for acne, for psoriasis, for other inflammatory conditions.